My story is a little bit different. My name is Sam Toovy. About 10 years ago, I had a problem, abdominal pains. And I went to my internist, and he said, I don't know what it is. I'm going to send you to a gastroenterologist. And the gastroenterologist checked me out and said, looks like you have chronic pancreatitis. So he started me on a low-fat diet and a few other pills and so forth. And I continued to have the pains. They weren't all the time, they weren't constant, but they were there. And I knew something was wrong. So the next 2 years, I saw several doctors, MRCPs, ERCPs, endoscopic procedures, one after another. They looked into the pancreas as well as everything else they could get to, I guess. And they said there's a little bit of calcium deposits, but that's not a problem. And so the pains continued. My wife and I, Barbara and I, went on a trip to Russia, and I ended up in the hospital for 6 days. The diagnosis was acute pancreatitis. And many of you may have been through that. It's a straight line pain that doesn't stop. So after 6 days there, we came back to the States, and this was in 2005. This all began in 2003. In 2005, we took the trip, came back. During 2006, I still continued to suffer, only things became worse. And went back to the gastroenterologist, and at one point, I began to get some internal bleeding. And so they did another endoscopy, took a test to the lab, came out negative. And he had the wherewithal to say, you know, I'm not sure about this. I'm going to send this to another lab. And so he sent the specimen back. And it turned out to be adenocarcinoma. And this happened to be, what he said was I had an ulceration of my duodenum. So I didn't have the privilege of having a diagnosis. I was so sick that he asked me to come back, and I said, okay, we're going to do that. And the day that we came back, I told my wife, I said, I'm not coming back home. I am going to the hospital. I have to. So I knew something about myself, and I knew something that was wrong. So we went to UCLA, and 2 days later, I was admitted. 2 days later, I saw Dr. Reber, and this time he talked to me. I had the family around, and he said, I think I can help you. I said, fine. I liked him immediately. So the family went back home, and of course they didn't know who he was, and they went back to their computers and checked about Dr. Reber online. Of course, they had a list this long of his achievements, etc. And so I was happy from the very get-go. And so I never had a diagnosis, so I went directly from being sick to having the surgery. After the surgery, I started chemo in February of 2007. And that lasted about 6 months. I can tell anybody, I mean, I'll be available at any time for anybody if they want to know anything about side effects from chemotherapy, but I did have a couple I can tell you about. One, I left Dr. Reber's office on this, I think it was the first year of checkup, and I noticed or felt a pain in I think it was my right calf. And 3 days later, my legs turned blue, and I went to see the internist. They put me in the hospital. It turned out to be blood clots. Shortly after that, I had a screen put into my left groin area, the vena cava, to stop a possible embolism. It would have been an embolism of the lungs. So after that, I had another episode, and it was we didn't go to the hospital, but I ended up, that was taken care of by medication and so forth. And so with that, The second side effect I had was depression. And that is something that I'm sure many of you have had the opportunity to go through, and it wasn't fun. But my wife kept me from sitting around feeling sorry for myself. She had me on the go. We went places, we did things, and she took care of me for a full year. She was my caregiver. And that brings me to the end of the story. However, I went back to work, but I couldn't work like I did before. I was on a full day, 2-day-a-week schedule with my patients, and after that I went back part-time in the year 2008. A couple of hours a day for the first 6 or 8 months. After that, I began to do a little bit more, and I'm still practicing. And at this point, I feel good. I don't have the strength I used to have, but I've done everything. At any point, anybody wants to ask me about other side effects, I can give you a host of them, and maybe we could share all of that. So with that, thank you very much. I appreciate it.